Hello class, my name's Miss Monroe. I'll be your regular teacher for Med-Surg I. However, for the first week and a half, you will have a substitute teacher. Okay, Miss Vandergriff. Usually on the first day of class, we go over the syllabus, so maybe Miss Vandergriff would like to pause the video right now so that you may go over the syllabus. All right, after that, we will just start in with our first lecture. All right, we'll just have one chapter today. That will be chapter 1, so let's get started. Hello class, this is chapter 1, Aspects of Medical Surgical Nursing. Our objectives for the slides: identify the most appropriate source of information about the role of the licensed vocational nurse, licensed practical nurse in medical surgical settings. Now that would be your State Nurse Practice Act. We'll be talking a little bit about that, but that is your number one source. Describe the essential knowledge and skills needed by the medical surgical nurse. Describe the principles of ethics that may apply when caring for medical surgical patients. Provide examples of nurse behavior that violates laws governing the profession. That would be things like HIPAA and not guarding a patient's information and their privacy. All right, 5, describe the characteristics of effective leaders and managers. And for your test, you should know the difference between those two words. What is a leader? What is a manager? They're not always the same thing. All right, 6, describe essential elements of delegation. And to know what you can delegate, remember, you're going to look at your State Nurse Practice Act. It will have things that you can delegate in it and things that you can't. All right, 7, describe the following in relation to LVN, LPN, as manager, making assignments, accountability, conflict resolution, and safety. Describe the 6 cognitive skills that are essential for appropriate clinical judgment. Okay, and describe the test formats used for assessing cognitive skills. All right, so our first slide, professional organizations. Now, 2 of these things on this slide are professional organizations. All right, and that is the Academy of Medical Surgical Nurses and the National Gerontological Nurses Association. All right, these 2 organizations give advice. They set the standards for practice. They make suggestions on those standards based on research, and they come up with standards for best practice. All right, but they do it in different areas, and these areas sometimes can overlap, right? So we have one organization that deals with the medical surgical areas, and the one that deals with suggesting what the scope of practice should be for elderly populations. Now those overlap because what do we have a lot of times in the hospital on the medical surgical floor? A lot of times it is elderly patients, right? All right, so these organizations, they run studies, they do research, they suggest, what should be the standard of care in these different areas. And other organizations like the state of California, they'll look at what these organizations are suggesting, and they'll look at the research they've done, all right, or any studies that they've done, right? And they'll decide, what do we want to make law, right? What do we want to make the legal standards of practice, right? And they'll look at these different organizations for suggestions and for research to make a law, right? And the law for nurses, all right, is the State Nurse Practice Act, right? If you do something that this act says you're not allowed to do, you've actually broken a law, right? If you don't pay attention to the suggestions of the Academy of Medical Surgical Nurses, all right, as long as that suggestion isn't also in the Nurse Practice Act, right? If you don't listen to them, you haven't broken a law. You're probably not maybe giving the best care, but you haven't broken a law if you don't do what this academy tells you to do. All right, but if you don't do what the state tells you to do in the State Nurse Practice Act, you've actually, done something that's against this law, right? All right, and you can be sued for that. You can even be criminally sued. You can be civilly sued, right? If it was civil, maybe the patient's family might want to sue you for something. If it was criminal law, even the state itself could cause a consequence for you and sue you. All right. Okay, so I kind of put the State Nurse Practice Act into this slide, all right, because it is the thing that we go to first before anything else, before any of these associations or academies, right? We go to that first to figure out what we have to do as a nurse, right? What we can legally do as a nurse, what can we delegate to other people to do for us, right? It's all going to be in the State Nurse Practice Act. So it is the go-to source, right? Okay, it's above any of these others, right, that do studies, right, and suggest standards of care. All right, the difference between the State Nurse Practice Act and some of these organizations is usually every state has their own. So California has their own, right? Other states will have their own, and they may be different. They may not be the same state to state. Maybe you can do something in one state that you can't do in another, right? But that would be in their Nurse Practice Act. All right, but these organizations, many states may look at them, right? Any state. All right, so that's kind of the difference between these things, all right? The Academy of Medical Surgical Nurses, they're not a law, and they can be used in any state, right? Whereas the State Nurse Practice Act is a law, okay, and it's specific to California. It's only used in California. All right, roles of the LPN, LVN, right? How can you know what your role is? Well, once again, that will be in your State Nurse Practice Act. All right, but the roles of an LPN, LVN, once again, specified in the State Nurse Practice Act where the nurse participates. Examples include caregiver, care coordinator, patient educator, case manager, counselor, patient advocate, consultant, researcher, administrator manager, staff educator, expert witness, right? All right, you guys, everybody knows what a caregiver is, right? It's someone that provides care, but maybe some of these other things you don't know what they're talking about, right? When they say care coordinator or they say case manager, right? What are those roles? Well, that happens when you need to coordinate care between two different places, right? A care coordinator, which means you have to maybe, if you're working in a hospital, you have to find a bed maybe for somebody in another facility like a rehab center or a nursing home, right? So you have to call around, you have to find a place that has an opening for your patient, you have to make sure that place that the patient is going to has all their medical records, right? You set up the transportation. Are they going to go in an ambulance? Are they walking? Is their family going to take them, right? But you're sort of the go-between two organizations, right? Either your hospital and a rehab center, maybe the hospital and a doctor's office. You're setting up appointments for them, all right? Or the hospital and maybe home health, okay? But you're coordinating with the hospital when the hospital is going to release the patient and where they're going to, right? And you're communicating with the next facility, right? And you're telling that facility what do they need, what surgery have they had, right? Do they need dressing changes? Do they need oxygen? Do they need education on surgery or about diabetes, right? Okay, so that's what a care coordinator does. All right, and a case manager does similar things, right? They're managing the care of the patient, they're coordinating the care of the patient, right? Care coordination is just kind of part of case management. All right, but a case manager is doing the same thing, right? If the patient has to go to another facility, they're calling that facility and they're getting everything arranged, right? All right, patient educator. A lot of times we have to educate a patient on a new illness like diabetes. We have to show them how to check their sugars, draw up insulin, give themselves an injection, right? If they're in the hospital and they're going home, they're going to have to be taught all this information so that they can do it at home when they get there, right? And that's a lot of education, right? Using a glucometer, knowing the different types of insulin, what's a fast insulin, what's a slow insulin, right? All of these things that need to be taught to the patient, right? So that's patient education. Okay, most of these other things, you already know what they are. A counselor, a patient advocate, that means you're sticking up for the patient. If the patient wants some sort of care and they're not getting it at the hospital, a patient advocate would speak up for them and get that care for them, right? All right, whether it's the nurse calling the doctor because the patient's anxious and they want some medicine for anxiety, something like that, or maybe they're having pain, whatever it is, right? If they don't have what they need, nurses will speak up for the patient and they will get it, right? Now, nurses aren't the only ones that are patient advocates. There are people in the hospital that are actually called patient advocates. All right, and a lot of times that might be a social worker that can also get things for the patient that they don't currently have, right? That they need help to get. Things like getting on insurance to maybe pay for their hospital stay would be something that the social worker patient advocate would do. Okay, but in general, patient advocate just means we're standing up for the patient. We're speaking for them when they don't feel that they can speak for themselves, right? We're helping them get things, right, that they need for their care. All right, researcher. Okay, we talked about those organizations that do research and make suggestions for the scope of practice for nursing, right? So nurses do that research, right? So nurses can be researchers, right? They can be administrators, staff educators, as well as patient educators, right? If the nursing staff has to learn something new, it might be a nurse on the staff learning the information and then bringing it to the rest of the nursing staff and educating them on it. Expert witness, this is usually a nurse that goes to court, right? If a nurse is getting sued, what better person to say what a reasonable nurse should have done than another nurse, right? And oftentimes when a nurse gets sued, that's what they're trying to find out. Would a reasonable nurse do the same thing in a similar situation, right? Okay, so sometimes you might get called to be an expert witness, right? It may be another nurse gets sued, right? You'll be the expert witness saying what a reasonable nurse would do in a similar situation. Okay, whether that's what that nurse did or didn't do, right? You would say, what would a reasonable nurse do? Okay, some roles require collaboration with a registered nurse. Okay, others require specialized training or certification. For instance, a lot of times nurses that are RNs, nurses that are LVNs are going to work with the same patient population, right? I did that as an RN when I worked in postpartum, which is where they take care of the newborn babies, right? Some people might call it the nursery. All right, but I worked with LVNs that were taking care of those patients, and I was taking care of those patients as well. And there were some roles that we could both do, and there were some roles that just an RN could do, right? So we would get a team of patients rather than having our own patients, right? Instead of getting 4 mothers each, we'd get 8. And that way our ratios, our patient-nurse ratios, would be the same. But all 8 patients, if they needed something that the RN was able to do and the LVN was not, then all 8 patients could get that care. For instance, when I worked with an LVN, and we had 4 mothers and their babies, each, right, which would have been a team. We'd have, together we'd have 8 mothers and 8 babies. We would sort of break up our work, right, according to what we could do. So LVNs can give PO or oral medication, right, pain medication. So perhaps all the oral medications the LVN would do. And then when a patient needed an IV medication or needed IV fluids, then I would give those things, right? And so we'd kind of break up our work. LVNs usually aren't able to do the first primary assessment, right? So I would do assessments on all 8 mothers and babies. But then after that, the LVN could do maybe the every 4-hour vital signs, right? Mostly on the mother, because we don't really do that much with the babies, because newborn babies, at some places we don't do things like blood pressures, but we would still do temperatures and that sort of thing. All right, but the LVN could help with that. And then the RN could do all the assessments, right, of babies and moms, that sort of thing. So that's collaboration, when you get together and you kind of decide how you're going to take care of your team or what you're going to do for a certain patient. All right, specialized training. All right, now usually in California, LVNs right out of school, they can't do things like start an IV or draw blood, right? But if you get special training and you get a special certificate to do those things, then, even right out of school, you'll be able to do those things. For instance, Gurnick does offer an IV start class, right? So if you take that, then you will be able to insert IVs, right? You won't be able to give the medications, but you'll be able to start the IVs, all right, which could be very helpful in some areas of nursing, right? Maybe the ER, where they're always starting our IVs and things. All right, but you can do more if you get extra training after you get your LVN license and your schooling done. Okay, practice settings. All right, medical surgical nurses may practice in a variety of settings. All right, and sometimes in the ER, right? You can work in the ER, you can work in clinics, the different places, right? But some of those places are acute and subacute care facilities. What is an acute care facility? Well, it's facilities that happen to take care of things that are new. They're happening right now. That's what acute means, kind of. It's a thing that's just happened right now. All right, so that's probably working in a hospital, working in an ER, that sort of thing, right? Working in an ICU. All right, those would be sort of acute care settings. And subacute means maybe care that you're going to receive after something has happened and you're not quite fully recovered from it yet. You're in the process of recovering. All right, and then you might go to a subacute facility. So maybe you had a stroke, you went into the ER, and then you got sent to the Med-Surg floor, and now you're a little bit better, but you still need to recover, right? You might go to a subacute care facility, maybe something like a rehabilitation center, right? You might not be going home, right? You'll go somewhere where you can get some care. It's just not as acute, right? It's when you're sort of recovering. All right, then there's home health care, right? If you're not going to go to a subacute facility, you're going to go home. You may still need nursing care, right? So there are nurses that they just work in home health, all right? And they go to people's homes. They do things like dressing changes. They do diabetic teaching, right? They do wound care, that sort of thing, right? Just in the home instead of at a facility. All right, there are ambulatory clinics, right? What does ambulatory mean, right? Well, it means you're walking, right? So these are clinics where you don't stay overnight. You walk in, you walk out, right? An ambulatory care facility or an ambulatory clinic. Okay, outpatient services. That could include an ambulatory clinic, right? Okay, but it's things that you do outside of a major acute care or subacute care facility, right? So it might be doctors' visits for procedures or small surgeries, all right? But once again, generally, maybe not even staying overnight, right? You're going in, you're coming back out. All right, residential facilities, right? Residential means you're living there, okay? So that would include things like nursing homes, rehabilitation centers, those sorts of things. Skilled nursing facilities, right? That is one type of residential facility, right? Because people tend to be living there because they need constant nursing care, right? Okay, other places nurses can work, medical offices, especially if the doctor does small surgeries and things. He might want to have a nurse in his office. All right, adult daycare, primary care areas, right? Doctor's offices are primary care. Schools, there are school nurses. All right, not every school setting will use LVNs, but I know here in Fresno, the County Office of Education, where they have people with special needs in schools, they do hire LVNs. Sometimes even one student might get their own LVN that's paid for by the county because they have very severe medical needs, right? Or a nurse might go from school to school, maybe just to give a child their medications and things like that. All right. Um, Now, the Fresno Unified School District, they don't generally hire LVNs, but the County Office of Education, they do. So if you like working with children, you don't mind working with children who are very, very sick, that's a place you might look at. Correctional facilities, right? Those are jails. I think we have Corcoran near to us, right? And they're also a good place to work, right? Usually get paid a little bit better at a correctional facility. Okay, and there's also private businesses, insurance companies, and things like that can hire nurses, all right, to help them, you know, decide if they want to pay for something that a patient might need, right? They might use nurses for that. Okay, essential knowledge and skills. All right. These things guide nursing assessment, planning, intervention, and evaluation. All right. Okay, practice requires the knowledge of these different things. So pathophysiology, right? That's something you'll be learning in nursing school, right? You're going to have your anatomy and physiology class, right? You're gonna learn maybe at the cellular level or the tissue level what's going on in certain conditions or illnesses, right? For instance, if you're dealing with diabetic patients, you might have to know, why the person has diabetes, right? Well, it might be because their pancreas, right, isn't producing enough insulin, or their islet cell of their pancreas aren't working properly, right? And that's why they're not producing enough insulin. All right, so you'll have to know the pathophysiology, the manifestations. If we're talking about diabetes, well, you could get high sugar levels that can be dangerous. With the medications that we give for diabetes, that might cause the opposite, low sugar levels. That can be very dangerous. So you kind of have to know those signs and symptoms, what to expect, all right, with a patient with diabetes, right? The manifestations. Okay, the complications, right? That could be hyperglycemia, that could be hypoglycemia, right? High and low blood sugars. But it could be other things like slow wound healing, ulcers that don't heal, right? Neuropathy, which is numbness in maybe the feet, right? Numbness and tingling in the feet. All right, you're going to have to know about treatments. You're going to have to know about the different insulins and things we give to our patients so that you can do your patient education on them, right? You're going to be teaching your patient how to draw up insulins, how to inject themselves. So before you can teach them, you have to know about those treatments, right? So you have to have knowledge of treatments. Nursing interventions, right? There are a ton of things that nurses do, right, called interventions, that we would do maybe for somebody with diabetes, okay, or with a wound, right? You would have to have knowledge of all of those things, like patient teaching, wound care, preventing neuropathy, preventing ulcers. Okay, expected patient response, right? So, once again with medications, if you're going to give a medication, you should know what the expected response the patient will have with that medication, right? So if you give them a couple of units of insulin, how far, how much lower do you think that will make the patient's blood sugars go, right? Okay, and if you get experience with that, you look at the patient's history and their orders and things, you can probably expect, if you give 2 units of regular insulin to cover a breakfast meal, you're going to know that that's not going to drop their sugar significantly, right? That would be a danger to them, right? Because you're having a reasonable expectation, right? That quantity of insulation is just going to lower the sugar a little bit to kind of cover that meal that they're going to eat. Okay, pharmacology. You're going to have a class in pharmacology, right? Very important class where you're going to learn about the different insulins, which ones are slow, which ones are fast, right? Which ones work all day, which are going to work in 5 to 10 minutes, right? That sort of thing, right? It's very important. You're going to learn how, why do antibiotics kill infection in a wound, things like that, right? So you're going to have to learn pharmacology. All right, medication administration. Once again, in pharm class, you'll probably learn what medications can be injected into the muscle, what injections are injected into the adipose tissue, right? What things are injected into the blood. Okay, what things can you give by mouth, right? If you're giving IV things, even though LVNs don't give IV medication, they should know a little bit about how fast some medication should go, so that they can recognize if maybe another nurse isn't quite doing things the way they should be done, right? If the nurse is making an honest mistake, they could bring that up to the nurse, maybe prevent some harm coming to a patient, right? So even though you don't give the medications, you should know a little bit about them, right? What things can be given IV, how long should they run, okay? What are some side effects you should be looking out for, right, with certain medications? How would you know somebody was allergic to that medication, right? What sort of reactions would they have? Things like that, right? So very important, medication administration, okay, and that goes along with pharmacology, right? So you have to know all these skills, okay, to be an effective nurse, right? To be a safe nurse. All right, ethical considerations. All right, you guys, you'll probably want to know, what are ethics, right? What is morality? What are values? All right, ethics defines within a group what actions are right and wrong, whether the motives and outcomes of those actions are good or bad, right? So ethics, we really wouldn't use that term really to describe what just one person thinks is right or wrong. Usually when we're talking about ethics, we're talking about a large group of people, right? What's right and wrong for a group, or maybe even an entire profession, right? Okay, so we have our ethics in the nursing profession. Things like we think it's important to provide privacy for a patient, to not let their information get out and known by people they don't want to know the information, right? So we think, those HIPAA laws are very important, right? Okay, whereas, other people that aren't nurses, that aren't in our profession, they might not even know what HIPAA is, right? Okay, but HIPAA is part of the ethics of being in the nurse profession, in the medical profession, right? So all of these words kind of might sound like they're talking about the same thing, right? What's right and wrong, okay? The difference comes in is the size of the group, right? So when we're talking about professions, we're usually talking about what the profession thinks is right or wrong. We're usually going to use that word ethics, right? Ethics, we're talking about a big group. Okay, maybe a profession, a religion, something like that, right? Maybe the population of a country, right? We're talking about a large group. What's right and wrong for the group, right? What's right and wrong for the group might not always be what an individual, just one person, thinks is right or wrong, right? Okay, but ethics is kind of referring to, what is right and wrong for a large group. All right, morality is closely related to ethics, but is the individual's foundation for rules of action, right? So what's right or wrong, sort of in society, right? Morality, once again, that could be coming from our religion, that could be coming from what our family taught us, right? But it's usually, it's referring to the individual, but the values that individual believes in have come from something in the society, right? Their religion, their culture, right? Their family, right? So morality is kind of a societal thing, right? Okay, and different people pick up different values from society. So it's not going to be the same for any group, all right? But it's more the individual is learning from basically a group, right? Learning from their church, learning from their family, all right? What they think, what the individual thinks is right and wrong, right? So once again, ethics is more what a group believes. Okay, morality is what an individual believes, but they're getting those values from a society or from their culture, right? Things like religion, school, family. All right, values are specific beliefs and attitudes that influence the choice a person makes. So this one, we're really talking about the individual, right? Okay, where do they get their beliefs from? Where do they get their values from, right? Now, if someone were an individual, say in a church or something, they might get some of their values from that part of society, that culture, right? Okay, but then an individual has values that don't come from religion or from other groups, from family, right? Sometimes they just decide what's right and wrong on their own, right? They see something and they think it's either right or wrong. Nobody has to tell them what they think it is, right? These are their own personal values, right? Okay, they're not being told by someone else what they are. They're kind of deciding for themselves what they are, right? So these are an individual, personal beliefs of right or wrong, right? Don't necessarily have to come from society, right? They can decide from themselves, right? All right, so that's sort of the differences in them, right? Ethics, more of a large group, a profession. Morality comes from smaller groups like our church, our family, right? Our organizations that we belong to. Okay, and then values, things we kind of decide for ourselves, right? What is right or wrong, right? Okay, and our individual beliefs might even disagree with beliefs of society or the beliefs of our profession, right? Okay. In a bit, we're going to talk about ethical dilemmas. Okay. That's something that's involved with ethics. And an ethical dilemma is when our personal beliefs don't agree with the beliefs of our profession, right? And a good example of that would be a patient is part of a religion that doesn't allow them to get blood transfusions. and maybe they need the blood transfusion or they're going to die, right? Get the blood or they're going to die. And the patient believes so strongly in their religion that they say, well, if I die, I die, right? But as a nurse, you're thinking, well, I want to do everything I can so that person doesn't die. And you may want to give that blood to them. You may want to force them to get that blood so that they don't die. But you know, legally, you're not able to do that. You're not allowed to do it, right? Okay, and ethically, you're not allowed to do it, right? Because the ethics of your profession don't allow you to force somebody to do something they don't want to, right? Patients have autonomy, right? And that means patients get to decide what care they want, and they can turn down care that they don't want, right? But for the nurse, that might be a dilemma. They want to give the blood. They want to force the patient to get it, right? But they're not going to, because for one, it's against the law, right? And nurses usually, no matter what their feelings are, you know, if they're good nurses, they will follow the ethics of their profession, right? Okay, even though they may feel differently about it in their own mind, all right? Their values may be different from the ethics of the profession, right? All right, ethical considerations, right? Okay, these are principles of ethics, right? And most of these are part of, you know, the ethics of nursing, of our profession. All right, the first one up here is autonomy, right? And autonomy means that the patient gets to make all their own medical decisions, right? They have to give permission for us to do anything to them, and if they want to, they can refuse any treatment. They can refuse their vital signs. They can refuse their medicines. They can refuse their surgery, right? Autonomy means they have the right to make their own decisions, right? Nobody can make a decision for them, right? All right, so autonomy respects individual rights, right? We can't force them to do anything they don't want to do. Okay, beneficence. Okay, in Latin languages, you know, Italian, Spanish, ben, right, means good, right? Oh, I was just trying to think of the Spanish word. All right. But bene, right, in Italian means good. Bien in French means good, right? Ben in those Latin languages usually means good. All right. So this word means that we only do good for our patients, right? We act in the patient's best interest. Now that's different from do no harm, right? Okay. It means we're only going to do things that are good for our patients, right? All right, so ben, remember those Latin languages, that means good, right? Now in non-malfeasance, okay, that means do no harm, right? You guys, the word non in a word usually means we're not going to do it, right? Okay, so we're not going to do harm. And once again, in those Latin languages, mal, right? In Spanish, mal means bad, right? So we're saying non-mal, non-bad, not bad, all right? So we're not going to do any bad, right? Non-malfeasance, okay? Beneficence, we're just going to do good. Non-malfeasance, we're going to do no harm, right? We're not going to harm the patient, all right? If there's something that's ordered and it's going to harm the patient, then we're going to talk to the doctor, because we're not going to do that thing, right? Okay, non-malfeasance, do no harm. All right, and beneficence, do only good, right? Act in the patient's best interest. All right, justice. Consider fairness, equity, and appropriateness. All right, so justice means that we give our care to everybody, right? Equally, right? We don't just give it to the rich people. We don't just give it to certain genders, right? We give it to everybody equally, right? As equally as we can, right? So justice means everybody gets equal care. Everybody has access to all the same medications as anybody else, right? Now, this is what we want. This isn't always possible, right? Okay, everything isn't always just. All right, and a good example of that was during COVID, right? Everybody wanted the vaccine, right? Well, most everybody, right? A few people didn't. But so many people wanted the vaccine, and we didn't have enough. So we couldn't do justice. We couldn't give everybody that wanted to give them a vaccine, right? Because we just didn't have enough. So what did we do? We tried to be as fair as we could. We said, well, the people that are most likely going to get sick, we're going to give them the vaccine, right? So that meant that we gave, in the early days of COVID, we gave that vaccine to the very young because they were likely to get very sick from COVID, and the very old because they were likely to get sick from COVID. And then also people that worked with people that were very sick from COVID, right? So that would put them at risk for getting COVID, right? So that meant hospital workers, right? Doctors, nurses, all right? They got the vaccine as well, right? Because in those early days, there were doctors and nurses dying because they were taking care of COVID patients, right? All right, so those people could get the vaccine, right? Either the very young, the very old, or healthcare workers. And that means if you weren't one of those things, you couldn't get the vaccine right away, right? Okay, because there just wasn't enough. So if you were a young, healthy 20-year-old and you just wanted the vaccine, right? And you didn't work in healthcare, you weren't an essential worker, right? Then you couldn't get the vaccine. All right, so we couldn't do justice, right? We couldn't do equity, which means giving everything equal, right? We had to pick and choose, right? So we tried to do our best, okay, to give out the vaccine in an appropriate way, even though we couldn't give it out equally to everyone, right? We couldn't do equity. All right, but we tried to do the fairest, most appropriate thing that we could do. All right, but that's kind of what that word means, right? It means treat everybody the same. All right. Okay, we went over non-malfeasance, right? Non-mal, do no harm. Right? Confidentiality, protect the patient's privacy, right? That's where those HIPAA laws come from, right? We can't give out a patient's information to anybody. The patient doesn't tell us it's okay to give it out, right? Okay, so we can't tell family members what's wrong with the patient if the patient tells us he doesn't want the family members to know, right? We have to keep their confidentiality. All right, veracity, right? Okay, this means we're only going to tell the truth to our patients, right? So we're not going to go into the room, right, with a syringe full of normal saline and tell the patient that it's their pain medicine, right? Right? We're not going to give them a placebo, right? That would be a placebo. All right, we're always going to be truthful to our patients, right? So most of the time we can't give a placebo. We can't tell our patient we're giving them one thing when we're actually giving them another, right? We always have to tell the truth, right? Right? We never lie to our patients, right? So veracity, be truthful, honest. We never lie to our patients. All right, now a word that's very similar is fidelity. Okay, and it's a little bit different from you can only tell the truth to your patient. All right, it includes that, okay, but maybe like if you wanted if your patient wanted some pain medicine and you said, well, you can't have your next dose until 30 minutes from now, and you told them, hey, I will be back in 30 minutes and I'll bring your pain medicine, right? Now, if you're practicing fidelity, you actually come back in 30 minutes with their pain medicine and you assess their pain, and if they're still in pain, then you give them their pain medicine, right? All right, if you came back in an hour, you wouldn't have kept fidelity with them because you promised them 30 minutes and you came back, an hour later, right? You didn't keep your promise. You were unfaithful, right? Okay. All right, so we always keep our promises, fidelity, and we always tell the truth, right? Veracity. All right, and we always do things fairly, right? Justice. Those all kind of go together, but they're slightly different, right? Now, you guys know every one of these words, because I think I put every single one of them in your test, right? So you might get an example of this is going on with the patient, and this is what the nurse does. Did the nurse obey the principle of autonomy, or beneficence, or justice, or non-malfeasance, right? So know what every word on this slide is, right? Okay, because you'll probably see it very, very soon, right? Everything on this list. All right, ethical dilemma. We just talked about that a little while ago. It's when maybe the nurse's personal beliefs don't go along with what her profession says she should do, right? Okay, her values aren't the same as the ethics of her profession, right? And this could be an ethical dilemma, right? So an ethical dilemma is a conflict between the ethics of the profession and a person's morals, right? So you might think, I want to save everybody, right? Even if they don't want to be saved, right? With that patient we were talking about that didn't want the blood, but they were going to die if they didn't get the blood. In your mind, you might want to just force them to get that blood, right? But you're not going to do it because you know that the Nurse Practice Act isn't going to let you do that. The ethics of your profession isn't going to let you do that. And probably the administrators at your hospital wouldn't let you do that, right? They wouldn't let you go against the patient's autonomy, right? Okay, and give them something that they didn't want, because that would actually be a harm to them, right? They'd be very upset, right? And they'd be very stressed because they think they haven't done what God wants them to do now, right? So you would have harmed them, right? You would have not obeyed the principle of non-malfeasance. You would not have obeyed the principle of autonomy, all right, or beneficence, okay, all right, because you didn't let the patient decide what they wanted, right? To them, they didn't think giving them blood was a good thing, right? So you didn't act only in their best interest because you're going against what they wanted. Okay, and you may have even harmed them, okay, spiritually, psychologically, right? So you wouldn't have obeyed the principle of non-malfeasance, right? Do no harm. All right, but that's an ethical dilemma, right? Sometimes nurses don't agree with what their profession, right, and the ethics of the profession are saying they should do, but most nurses will do what they're supposed to, right? They will follow the ethics of their profession, right? And they'll follow the law, right? They'll follow the Nurse Practice Act, right? Okay. All right, legal considerations, right? Okay, laws define the functions and limitations of nursing practice. okay? So laws like the Nurse Practice Act, right? Okay, major legal risk in nursing practice, right? A tort, a civil wrong against a person or property. All right, so getting back to that example of if you were to give a patient blood after they told you they're refusing it, that they don't want it, and you gave it to them and you harmed them, right? Maybe not even physically, but emotionally and spiritually, you harmed them. All right, you would have committed a tort. You would have committed a harm. That's what a tort is, right? It's a harm that you've done. Okay, it's something wrong that you've done, right? So a tort is a civil wrong against a person or property, right? So if you gave somebody blood and they didn't want it, you would have harmed their person. All right, they told you no and you did it, right? You would have committed a tort. All right, you would have committed a harm. Now, civil just means it's not, it's not criminal. They're not going to put you in jail, right? Maybe if you gave that person blood, well, maybe they'd put you in jail. Who knows? Maybe they'd do a criminal case. But if they're doing a civil case, right, it means that they're not going to try and get you put in jail. It means they're going to sue you maybe for money or to take your nursing license away, right? Civil also means that it's not the government suing you, all right? It's an individual, right? Okay, a criminal tort would be the government maybe could sue you, right? But a civil tort, right, which usually happens in healthcare if there's a tort, right, if there's a harm, it's going to be civil. So it's going to be one person, right, suing another person, right? Patient's family suing the nurse, right? If the nurse gave them blood that they didn't want, they could definitely sue, right? All right, so a tort is a civil wrong against a person or a property. All right, malpractice, the term used for professional negligence, right? Okay, so first we have to know what negligence means, all right? And negligence means that you should have known not to do something, right? Maybe you didn't know, but you should have known. All right. It usually means you should have, either you didn't know or you should have. I mean, it means either you knew or you should have known that you weren't supposed to do this thing. So once again, forcing a patient to get blood when they didn't want to, right? As a nurse, you should have known, right? And maybe you did know that you shouldn't do that, right? So you were negligent when you did that. You were negligent when you did that harm, all right? Now, when someone does harm to another person, it's not always negligence, right? If they truly didn't know and there's no reason they should have known, right, then it's not negligence, right? For instance, if a bystander who wasn't a nurse or a doctor or anything tried to help someone in a car accident, and they pulled them out of the car and accidentally made an injury worse, right? And the person's harmed. They wouldn't have been negligent because there's no reason they should have, if there's no reason that they should have known it wasn't okay to pull that person out of the car. Maybe they were thinking the car's going to catch on fire, whatever. They're trying to save their life, and accidentally they make something worse, right? That person usually, they wouldn't be accused of negligence because there's no way they should have known, right? That they would maybe make something worse by acting and trying to help the person. All right, but say a paramedic does that, and he knows how to maybe move a person, right, without creating further injury to that person, right? Like they maybe know, if you suspect a neck injury, maybe use a neck brace before you try and move the person, right? Okay, things like that. If they pulled someone out of a car and didn't do what they were supposed to do, that they knew they were supposed to do, then they could be accused of negligence. Okay. All right, that's negligence. And you guys, anybody can do something negligent, right? You knew you were supposed to do something and you didn't do it, right? All right, like you're taking care of your house sitting for somebody on vacation. You know you should have locked the door, but you didn't, right? And then a burglar breaks in. All right, well, that person would probably be negligent because they knew they should have done something and they didn't do it, right? Maybe they could get sued. All right, but when somebody has a professional license, they're not just your neighbor next door, all right, but somebody has a professional license, like a lawyer or a doctor or a nurse, right? Someone that is in a profession and has a license. If they commit negligence, it's not called negligence anymore. It's called malpractice. Because a practice is a profession, right? Lawyers have a law practice. Doctors have a medical practice, right? Nurses have a practice, right? And there's that term mal again, which means bad. So this word means bad practice, right? But only people with professional licenses can commit malpractice, right? Everybody else, it would be negligence, right? But if you have a license like a nurse or a doctor, then when you commit negligence, the proper term is malpractice, right? Okay, so know the difference between malpractice and negligence, right? One, only if you have a professional license like a nurse, right? Otherwise, it's negligence when you do a harm, right? Right? Maybe because you didn't do something you knew you should have done, right? Okay, now because nurses and doctors and everybody else with a license can sometimes, screw up, not do something they knew they should have done, right? Or not done something right. Okay, made a mistake. Anybody can get sued, right? And so this is where liability insurance comes into play. And there's two types that a nurse might have, right? Two types of liability insurance. One is the employer-provided malpractice insurance. Now, this sort of insurance doesn't cover you as the nurse, all right? It actually covers the hospital if the nurse gets sued, right? Because if you sue a nurse, you might demand that the hospital that employed the nurse would be responsible for that nurse and anything that nurse did, right? So hospitals, they'll get insurance on their employees, right? And if you get sued, it's not really going to pay for your bills. It's going to pay for the hospital's bills, right? That they incur because they have to now go to court and defend you and themselves, right? Maybe because as a nurse you did something, right? So this won't stop you from losing your house, from losing your car, right? It's gonna help the hospital not lose things, right? So now there's a second type of insurance that will protect you, will protect your house, your car, your bank account, all of that. And that's personal liability insurance, right? Now that is something the nurse would pay for on her own, right? Whereas the other one, the employer-provided malpractice insurance, the employer's providing it, even though they're providing it for you in case you do something. It doesn't always cover you all the way. All right, so that's why some nurses choose to get personal liability insurance. This will cover them, but they have to pay for it, right? Okay, but it might protect their house. If they have any property, any assets that a lawyer could go after, right? Okay, so you have money in a bank account, that sort of thing, right? If you have things that are worth a lot of money that you could lose in a lawsuit, that's when you'd want to think about getting personal liability insurance, right? Nursing insurance for the nurse, right? The nurse pays for it. All right, question 1. What law defines the functions and limitations of nursing practice? All right, we have the Academy of Medical Surgical Nurses. We have the National Nurse Practice Act. We have the State Nurse Practice Act. All right, we have the State Scope of Practice Act. All right, I'll give you a few seconds to think about that. Which one would you choose? All right, if you chose C, the State Nurse Practice Act, that was the right answer. Remember, that's a law, and it tells nurses what they can do, right? Remember, the Academy of Medical Surgical Nurses, they do studies, they can make recommendations, but they're not a law, right? But the State Nurse Practice Act is a law, right? Okay, so it's the law that defines the functions and limitations of nursing practice. All right, leadership and management. All right, when we were looking at the objectives, that first slide we had, I said you might want to know the difference between what is a leader and what is a manager. All right, so a leader doesn't always have to have a title like manager, right? Most people have worked with people that they weren't the manager, they weren't the boss, but there was that one person, working there that everybody went to for advice. And, the person that everybody listened to and they did what they said, right? Didn't necessarily have to have a title, right? Could have had the same title as everybody else, right? But because of their personality, because of their experience, right? People did what they said even without that title of boss, right? All right, so leadership it means the leader is somebody that people follow. They do what the person says, right? Even if they don't have a title. Now they could be the manager, right? And everybody listens to them, but they don't have to be, right? Okay, they don't have to have the title, but people still listen to them. All right, so leadership, broader and more future oriented. All right, so usually the leader, they have experience. They're looking ahead, right? They're thinking about, if we do something today, how will that affect us tomorrow, right? All right, and the leader creates a mission for the group to work towards. Maybe having things run smooth, not only today, but all week, all year, right? What can we put in place that's going to make things run smoother? All right, so that's basically the leader, right? The person everybody that listens to, whether they have a title or not. Now that brings us down to management, right? The manager, right? Now that person has the title. They have the title of manager or some other title that means boss, basically. Now we've all, maybe not everybody, but most people have had a boss that has the title of boss, but nobody does what that person says, right? Nobody listens to them, right? When they're not in the room, they're not doing what the boss has told them to do, right? They maybe think, if they do something a different way, not the way the boss said, right? That they'll actually get things done quicker and better, right? So they're not listening to that boss. All right. And they're, that boss isn't the leader, basically. But they've got the title, right? They've got the title of manager or boss or administrative person, right? They got the leadership title, but they're not necessarily the leader. Now, they can be. They can be a great leader, right? They may have everybody listening to them and doing what they want them to do. All right, but not necessarily, right? Sometimes they just have the title. All right, and then sometimes people without the title are actually leading the group, right? Okay, now you can be both. You can be the manager, have the title of boss, and have everybody doing what you tell them to do, right? Okay, saying, yeah, that's the boss, let's do what he says. He's had experience, he probably knows how to get things done quickly, right? All right, but know that there's a little bit of difference between these two roles, right? The leader's going to be thinking about, how can things run well all year or all week. And the manager, they say he's more local and task oriented, right? He or she. That just means if you've got the title of boss, you want to get the things that you need getting done. You want to get done today. You've got this list of things, you need them done today, right? And whatever works for today to get them done is what you're going to tell people to do. And you're not thinking about next week, right? Okay, you're just thinking, I need these things done now, and once I get them all done, I've done my job, right? They may not be thinking about the future, right? Well, what about next week? What about tomorrow, right? Okay, so management focused on the day-to-day work of the organization, right? And they're more task-oriented. Whereas someone with leadership skills, right, they're going to be more future-oriented, right, broader, more future-oriented, and create a mission for the group to work towards, right? Like we all want to work as a team, right? Today, tomorrow, into the future, right? So that everything gets done in the easiest, most efficient way of doing it, right? All right, so know a little bit about the differences of what is a leader, what is a manager, what is management, what is leadership. Okay, leadership, the person that everybody listens to, no matter what title they have. And management has a title, and people may listen to them or may not, right? But they've got the title. All right, leadership and management. Okay, so a leader or a manager can do all of these roles, right? They can make assignments and they can delegate, right? Nurses are often leaders, right? They can be managers. They can be in the management, part of nursing, where they're probably, the leader of a group of nurses, right? All right, but nurses are leaders sometimes when they're just nurses, right? They have no special title, right? They're a leader with their patient, giving their patient education and advice on what to do, right? If they're an experienced nurse, maybe helping an inexperienced nurse, right? They might be leading in that capacity, but they don't have a title, right? But leaders and managers kind of have things that overlap, things that both do, right? So they can both make assignments and delegation, right? Assignment involves giving tasks to others and making certain that those tasks are done and carried out. And so once again, that could be just your ordinary floor nurse, okay, with no special title. But they might be leading a team that involves, an LVN, a CNA, other assistive personnel, right? And they're making assignments, hopefully collaboratively with talking things over with people. But delegating certain tasks out to different people, okay, making assignments, right? Once again, a nurse might have to think, well, what can an LVN do? What can a CNA do, right? And have the CNA doing the tasks that an LVN could also do, but maybe giving them more of those tasks, right, that they both could do, and then assigning just the tasks that a nurse can do to the LVN, right? Like giving medications and things like that, right? So, if there was an RN, she might be saying, okay, LVN, you're going to give medications, maybe other assistive personnel, you're going to handle vital signs, and things like that. All right, delegation, working with and through others, may involve supervision and training of unlicensed personnel. All right, so that would be assistive personnel. Okay. Now, if a nurse does that, either an LVN or an RN, whatever the nurse is, right, they have to know their Nurse Practice Act, right? Because the Nurse Practice Act is going to tell them what they can delegate to somebody else, right? So they have to know what they can do. They also have to know what the other person can do, right? What can they delegate? So for instance, you couldn't have a CNA passing out some oral medication, for instance, right? A nurse would have to know that that's not something she can delegate, right? And it's not something the CNA could do, right, legally. All right, so we have these 5 rights of delegation. All right, so the right task, right? Are they legally able to do the thing that you're going to ask them to do, right? Do they know how to do it? Have they had the training? Are they physically capable of doing the task, right? All right, so the right task, the right circumstance, right? Okay, is it a busy time? Do they have too much to do already? Are they going to have time to do this task that you're going to give them, right? Right. So the right circumstances, right? What's their patient load? How difficult is the patient? Are there family members and things that might interfere? That sort of thing. So the right circumstance, the right person, right? Once again, does the person know how to do the task, right? Have they had the education or the experience? All right, the right directions and communication, right? So make sure the person you're giving the task to, okay, knows what they're going to be doing for that task, right? So the right directions, the right communication, and the right supervision and evaluation. All right, so if a nurse gives a task away to somebody else, the nurse is still responsible for it. If the task doesn't get done, it's not going to be the fault of the assistive personnel, right? It's going to be the nurse's fault. And the reason for that is because every time a nurse gives a task, the nurse has to make sure it got done. All right, so that's where the right supervision comes in and the right evaluation, right? Sometime during the day, they're going to go and see, did that task get done, right? Did it get done the right way? All right, so if you're giving the task of turning patients every 2 hours, all right, it's the nurse's job to go and look at those patients and make sure that they see those patients in different positions throughout the day, right, to see that they've actually gotten turned. Because if a bed sore happens, it's not going to be the assistive personnel getting called into the office, it's going to be the nurse, because it was the nurse's job to make sure those things got done, even though she delegated the task to someone else. Okay, leadership and management, continued. All right, accountability, right? If I delegate a task and I go back and I make sure it got done, I'm being accountable, right? If I don't go and check on it and it didn't get done, right, I might be negligent because I knew I was supposed to check and I didn't, right? And if there was any harm done, I'd be negligent, right? I could be sued for malpractice, right? All right, so accountability. A person is answerable for his or her actions. All right, an LPN who delegates tasks is accountable not only for his or her actions, but for the actions of the staff he or she is directing. Communication is vital to accountability, right? So once again, it comes back to those rights. Okay, the right communication. Question 2. How will a nurse find out what he or she can delegate to assistive personnel? All right, I'll give you a moment to see which answer you would pick. All right, and if you picked D, the State Nurse Practice Act, you were correct. Okay. Now remember, it's the State Nurse Practice Act. So if you wanted to pick this one, the National Nurse Practice Act, it wouldn't be the right one because nurse practice acts are according to individual states, right? There's not a national one, right? There's not one for the entire nation. Okay, each state has their own, so it's the State Nurse Practice Act. All right, leadership and management. All right, so you guys, there will be some conflict resolution questions on your test, right? So that kind of pertains to this slide. All right, because sometimes when you're a leader or a manager, you'll have to deal with, other employees that maybe have a disagreement or they don't get along, right? And you might have to sort of intervene and help them maybe deal with their differences if it's affecting how their work gets done, right? So part of being a leader is conflict resolution. All right, so conflict arises from differences in many personal factors and may also be caused by unclear roles, right? So once again, those 5 rights, right? Right communication. If you're delegating to people, you have to make sure everybody knows what they're going to be doing, right? Okay, make the roles very clear so people don't get confused, right? And don't think they have to do something in a role, okay? Or they argue about it with other people, all right? Maybe also being told to do those roles, right? A lot of times with the CNAs that I've worked at in the hospital with, a lot of times it came down to how many patients a person would bathe, right? And someone that had very difficult, confused patients, they may not be able to get away from those rooms and do any bathing of patients, right? Because they're just so busy with what they have, right? And then maybe someone else has very easy patients that kind of take care of themselves, right? Maybe don't even need to be bathed, all right? And you might get a conflict where, the person with the patients that can walk and aren't confused, one nurse or one CNA might say, you know what, it's not fair I have to bathe all these confused patients that can't walk or do anything, right? They're already a lot of work without having to bathe them, right? Can't that other CNA, bathe these patients of mine, right? Because the patients that they have aren't so hard, right? So if something like that were to happen, you might have to look at, is that true, right? Does one assistive personnel have very easy patients and not much work, and another one has mostly all difficult patients and isn't really going to have time, right, to do everything that needs to be done for the patients, right? So you'd have to maybe talk to those assistive personnel. Maybe you would have to rearrange the assignments. All right. Okay, but that would be some of the skills that you'd have to have. All right, if you're a leader or a manager, right? Maybe you decide, the person with the difficult patients can do all of the care for them, and you're not going to change the assignment. All right, but you'd have to have the ability to make a decision on that, right? Okay, and to help the two people involved, right, if they were arguing about that, to understand why the decision was made, right? Okay, so that they're not arguing about it, right? All right, conflict creates stress and negative feelings that can adversely affect the work situation. Okay, LPNs, LVNs, and leadership or management positions must be able to facilitate the conflict resolution, right? So if you see two, assistive personnel that are maybe arguing, you want to talk to both of them and ask them, what the issue is, right? So that you can help them find a solution, right? The thing you don't want to do, if you know there's an argument going on and it's interfering with their work, is to just ignore them and hope it will go away, right? If you're being a leader, you're going to intervene. You're going to ask them, what's going on, and is there any way that you can help, right? Resolve the situation. All right, safety. All staff members, particularly team leaders, should learn their facilities' safety regulations. All right, this is our last slide. Clinical judgment in nursing. All right, so they've done studies on new nurses, and they've found that new nurses don't recognize a lot of the clues or the cues that will tell them something's about to happen to their patient, something serious, right? So they're emphasizing now on teaching nurses while they're in school, all right, that they need to be looking at cues or clues. All right, a cue is something that shows you something, right? It's like a clue. All right, and so they're saying that nurses need to develop some cognitive skills, all right, while they're still in nursing school, right? So they've come up with 6 cognitive skills for clinical reasoning and judgment, right? All right, and as I said before, a cue is a signal to someone to do something, right? So if you look at your patient's labs, you should be able to recognize when those labs are signaling to you that you need to do something for your patient, all right, because they might be starting to go downhill, right? You might not really see signs of stress yet, but a change in a lab value could mean the start of something, right? So nurses need to recognize changes in vital signs, all right, changes in lab values, And even know that sometimes pain can be a signal that something is going on, right? If they weren't in pain before, right, and now they're having pain, what's the cause of that pain, right? Could that be something dangerous, right? Vital signs. If you see a change in vital signs from their baseline, right? The vital signs they came in with, if they're not improving, right? Or if there's a significant change, say their heart rate is going up. It's a little bit faster than it was, all right? And their blood pressure is also going up, right? It's a little bit higher than it was before. Those could be signs of something just on their own, right? Your blood pressure goes up and your heart rate go up. When you're being stressed or something stressing your body, right? That could be an infection, right? That could be the start of an infection, all right? Say your blood pressure is going down and your heart rate's going up. That could also be a sign of infection, right? That could even be the start of sepsis, right? Sepsis is when an infection gets very, very serious, right? And your blood pressure goes down because you're having vasodilation with infection, right? All right, having tachycardia, that could clue you into your patients getting dehydrated, right? Okay, different things, right? So you look at the vital signs, all right? Now, if you see the change in the vital signs, right, and you're thinking, what could it be? Why are the vital signs up? Why is the heart rate up? Why is the blood pressure up? Why is the blood pressure down? Right? Why is the patient having more pain than they were before? Right? You want to take those into account. Usually, vital signs alone aren't going to tell you what's happening, right? But if they've just had a recent lab draw, maybe that morning, right? You could look at their labs. You could look at, their electrolyte levels, right? You could see if that's causing a problem, all right? You could look at a blood draw. Maybe the patient had a culture sensitivity, all right? That could clue us into an infection. Maybe they had their white cell count drawn, right? And that could clue us into whether their infection's getting better or worse, right? Now you're just beginning your schooling as nurses, so I wouldn't expect you to know everything going on with labs, right? White cell count, that could give you clues because our white cells, which are our immune cells in our body, tend to go up when we're having infection, things like that. So you might look at the labs, the white cells are going up, look at the vital signs, the blood pressure is going down, the heart rate's going up. That's going to clue you in to maybe there's sepsis going on here, right? Okay, pain that wasn't there before, that could also happen with infection and infection getting worse, right? So they want nurses to kind of think about, even when they're still in nursing school, right, putting different things together. Like not looking at just the labs, looking at pain, looking at the vital signs as well, right? Trying to figure out, is something going on with your patient in the early stages when you can help, right? If sepsis is happening, you can get better antibiotics ordered, right? If the wound's not healing, maybe we can find out why. Maybe there's infection, right? Infection will maybe stop the wound from healing. Other things like, are they receiving steroids? Are they a diabetic? Right? Other things can slow wound healing as well. All right, but just recognizing cues just means looking at everything you have available, all the information, right? And try and recognize something while it's in its beginning stages, right? Before it becomes a problem. All right, so things that could be cues are, of course, vital signs, labs, pain, you guys, lung sounds, bowel sounds, color of the skin, maybe level of consciousness, right? Does your patient have confusion when they weren't confused before, right? All of these things have to be considered, right, and noted. Okay, so you need to recognize what the cues are before you can even think about them, right? So you got to know that you should be looking at your labs, right? Your vital signs, pain level, going in and assessing the patient's level of consciousness, those kind of things, right? Once you know what the cues are, you can analyze them, right? Whatever your patient's problem is, what is causing it? Maybe their wound is giving them more pain, right? Okay, what could it be? Could you look at the labs to see maybe is the white cell count going up? Maybe it's infection again, right? Okay, are they becoming tachycardic, right? What's going on with the blood pressure? Okay, what's going on with the white cell count? That sort of thing. All right, so once you know what the cues are, you look at them, you try to analyze them, right? Think about it, try and think, if my patient has a slight problem, we don't want it to get bigger. What could be causing that slight problem? All right, what's causing the low blood pressure? Could it be sepsis? All right, what's causing the confusion or the decreased level of consciousness? Could they have low blood sugars, right? If you've had recent labs drawn, all right, you could look at the sugar on the lab, but you would also think to yourself, well, maybe I'll do a finger stick on my patient, right? I'll check his blood sugars. All right, well, maybe it's low O2 that's causing confusion, right? Okay, with your vitals, check the O2 stat, right? Ask them if they're short of breath. Look at their skin color, right? All right, pain. If they didn't have pain before, now they have pain. What could be causing it, right? Ask them where it is, if it's sharp or it's dull, right? What could be causing that pain? All right, so you're going to analyze the cues, right? Once you know what to look for, right? Okay, basically everything, all your information. Okay, try and prioritize a hypothesis, right? All right, so if your patient's in pain, it's coming from their chest, right? They've got chest pain. Well, that could be a heart attack. That could be chest pain from pneumonia, right? Maybe it's not a heart attack, but something's causing the heart to be hypoxic, right? Which means not getting enough oxygen, right? When your heart doesn't get enough oxygen, it causes you to have pain, right? So, use your cues to analyze your hypothesis, right? So your patient's got chest pain. Is it a heart attack? Is it pneumonia? What could it be, right? Now you can listen to their lungs, right? If they've got pneumonia, maybe there's going to be crackles in the lungs, right? What if those lungs are clear? Well, maybe we need to look at the heart then. Maybe you're having heart dysrhythmias, whatever. All right, so if the patient's on a telemonitor, look at the telemonitor strip, right? If you've learned to read telemonitor strips, okay? Which, by the way, in my Med-Surg class, we will learn the basics, right, of reading a telemonitor strip. All right, once again, if you're thinking it's heart, look at the labs, right? Are the electrolytes good? Have they done any labs that pertain to the heart, like troponin levels, right, or CK levels? Take a look at everything you have, right? Sometimes a clue that chest pain is related to the lungs rather than the heart is if the patient breathes in, and it hurts when they breathe in, but it doesn't hurt when they're not breathing in, right? Usually, that's a sign of some slight pleurisy, which you can get with pneumonia, right? Okay, if the pain doesn't change when you change the breathing, right? Okay, well, we got to keep looking for things, right? All right, and you may, if you don't have the information you need, right, to make a good hypothesis, you can always ask the doctor, right, for orders, right? You can tell the doctor, hey, my patient doesn't have pneumonia or anything. I've listened to his lungs. They're clear. That wasn't one of his diagnoses. He's having chest pain, right? You can tell him if the patient's already on a telemonitor, all right? And you can ask for something that will tell you a little bit more. You can ask for some labs, right? Maybe you think they didn't come in with pneumonia, but maybe they've got it now, right? You could ask for some labs, right? You could ask for a chemistry panel. You can ask for troponins or whatever, right? You can ask for a 12-lead EKG, right? Okay, and you can see what the doctor thinks and if he wants to order those things, right? And then you'll know more about your patient, right? Okay, but try and figure out what's going on with the patient with the information that you have. Prioritize your hypothesis. Well, do I think based on everything that's going on, is it pneumonia related? Is it cardiac related? Maybe it's just gas from a recent laparoscopic test, right? And if you know your patient just came back from having a laparoscopy, well, then you can kind of think, oh, okay, maybe that pain is just referred pain from the gas they injected during the laparoscopy, right? All right, but the thing is to get all your information and trying to figure out what's going on with your patient if there's something new that hasn't been there before, like an unexpected pain, right? Okay, once you kind of think you know what it is, generate solutions. What will fix it? Well, if you think they're having shoulder pain or chest pain because of the gas from the laparoscopy, right? You can kind of, tell your patient why they're having it. You think it's the laparoscopy, right? Maybe you don't have to do anything, right? Because eventually that gas will be absorbed, right? If it's just pain, right? You don't have any other things going on with labs or vital signs, maybe that's it, right? Okay, but if we're having vital sign changes, if there's something showing in the labs, right, that might account for some chest pain and they haven't had a laparoscopy, well, then we need to dig into that further, right? Why is that pain there if it hasn't been there before? What's going on? All right, maybe your patient has pneumonia, right? And you would expect some pleuritic or chest pain with that, right? Maybe look at the white cell count. It's not that high. Vital signs, they're still pretty good, right? Not that many changes, right? You might not have to do anything, all right? But that's where you get experience looking at cues, right? Recognizing when there is something really, really going wrong, right? If the white cell count is going up instead of down, that could be bad, right? If you're getting severe tachycardia with shortness of breath, right? That would be something you need to tell the doctor about, right? And maybe get more labs done or get a 12-lead EKG done on them, right? See what's going on. All right, so generate your solutions, right? Think about, well, what could fix this, right? Okay, and then you're going to take action. You're going to call the doctor, usually, if you need something to fix it that you don't already have, right? Even if it's just pain medicine, right? If they've got pneumonia, maybe it's just cough syrup, right? Their chest hurts so much because they've been coughing, right? Their vital signs are still good, right? Their labs look okay. Maybe, and they're saying it only hurts when I cough, right? Or the patient tells you this coughing is making my chest hurt, right? So you think, okay, well maybe some cough syrup will fix it, all right? Uh, Maybe um, a steroid to help get rid of the inflammation in the lungs would fix it, right? But think about what you want to ask the doctor for. You're going to call the doctor, and he's going to ask you what you want, why you want it, right? And so you're going to explain what's going on. You're going to use your S bar, right? Situation, background, so forth. All right. And then you're going to get your orders. That's going to fix whatever's going on, right? If it's cough syrup, if it's pain medicine, if it's an EKG, if it's some labs, you want to get some labs ordered, right? The doctor's going to want to know what your suggestions are because you're there on the scene, right? And then he'll decide if he wants to use those suggestions, right? All right, so take action. That is calling the doctor and getting your orders, right? So call and get orders for whatever's going to fix it, right? Pain meds, anxiety meds, right? Maybe just an EKG. You want to see if it's cardiac, right? Right? Chest X-ray. Maybe you think the pneumonia's getting worse. Say what you think you will need to find out if this patient's getting worse, all right, if things are going downhill, right? So taking action means calling doctor, get your orders, right? And then whatever he orders, go and get it, right? Go give it to the patient. If he orders pain meds, give what's ordered, right? Give the patient their pain meds, right? If he orders an EKG, get the EKG tech down, right? And get the EKG going, right? Then after all of that, right, evaluate the outcomes, right? Did whatever you asked the doctor for work? Did whatever you did for the patient, right? Did that work? Maybe they were short of breath and you lifted them up in bed and that kind of fixed the problem, right? Their shortness of breath went away. All right, it's not always you have to call the doctor, right? Some things you can do on your own, right? And a lot of times when a patient is out of breath, it's just because they're slumped down in bed and their lungs aren't expanding as much, right? And all you have to do is pull them up, right? And their breathing gets better and their O2 sats go up, right? All right, but whatever you needed to get, if you needed to get pain meds, did those help? Cough syrup, did that help? EKG, was everything normal on it? Was there something new on it? If there was, you need to call the doctor again, right? All right, so evaluate your outcomes. Have the things that you've done helped, right? Gotten rid of the pain, brought up the O2 sats, made the vital signs better, right? Okay, you evaluate your outcomes. Now those steps are a lot like what you probably learned in fundamentals, which is the nursing process, right? The first part of the nursing process says to assess, right? Before you do anything else, you assess, right? Now in this, that's recognizing cues, right? You're looking at your vital signs. You're assessing your vital signs. You're looking at your labs. You're assessing those, right? You're assessing the pain, right? When you're recognizing what things are cues, right? What things are going to tell me what's going on with my patient, right? All right, so this is a lot like the nursing process, all right, including doing interventions, right? That's taking action, right? Calling the doctor, pulling the patient up so that they breathe better, all right? And, evaluating outcomes or goals, right? Evaluating goals and things with the nursing process, all right? So it's very, very similar, all right, to nursing process. We're kind of doing the same things, right? All right, everybody, that was our last slide. All right, and I think I mentioned before I did give some little work packets that you guys can do in class, right? If these slides didn't take the entire time, right? So go ahead and work on those if there's time, right? If you don't have any extra time today, we might be able to use those during our next lecture. There's also a packet for our next lecture, right? So if you didn't use them today, you would have 2 for tomorrow. All right, and then you probably want to take both of those packets home, all right, on Thursday, even if you didn't get a chance to work on them in class, because they will help you study for your test, right? All right, everyone, that is it. Have a good day.